I know that there's been a lot of young people that have been reaching out to us, trying to really understand very complicated terms like social distancing and trying to translate that into their parents, like on the spot.
Reina Montoya leads an immigrant aid group in Mesa called Aliento. She says that role is something many young immigrants like her are used to filling.
Unfortunately, that's something that we had to navigate. I remember being very little when I first migrated to the United States here in Arizona and having to translate very complicated information to my parents.
Aliento posts bilingual updates and live Q&As on social media. Community radio stations and Spanish news channels have also helped fill that gap. But Montoya says the absence of bilingual information turns many elders to other, less reliable sources.
And something that we have been witnessing is that the president of Mexico was blasting on Facebook and on Twitter saying to hack each other. There was a video that went viral, and that's really impacting how our parents and how our community or the older population is really seeing that because of the lack of information coming from Arizona in their own language.
In Arizona, state and local officials are stepping up their messaging in Spanish.
Buenas tardes, Tucson. Soy la alcaldesa Regina Romero.
But questions about COVID-19 go beyond health updates.
I have to tell you that I've been ordering takeout for my best mama and pops restaurants that tend to be a lot of small Mexican restaurants, and they're terrified because they think that they're going to have to fire their whole employees, and they don't know what they're going to do if they're going to go out of businesses. So I saw that the Department of Commerce, specifically here in Arizona, came up with different ways that small businesses can apply for loans in these times of reliefs, but I have not seen these materials in Spanish.
Reaching some of Arizona's Spanish-speaking communities can be difficult even in normal times. Dr. Cecilio Rosales leads a team that conducts mobile health screenings for Spanish-speaking communities in the state.
We were going out on a regular basis with staff and students out into the community, literally to do basic screenings, whether it was in partnership with an organization, a nonprofit, non-governmental organization, or literally parking our mobile unit in a park within a neighborhood, or even on the side of the street.
Rosales says they often serve low-income, mixed immigration status, or uninsured families who don't think they have many health options. Her team connects them with resources.
We have this federally qualified community health center network across the nation, and that's a safety net for folks that don't have medical insurance.
Knowing where to go for health answers is especially important now. That's why Rosales' team is calling some 14,000 Arizonans previously screened in the mobile health units. One of those workers is Alma Ramirez in Phoenix. She typically calls people to follow up after visiting their communities. Now, she makes calls to answer questions about COVID-19.
There's more sense of urgency with everyone. And so this lady at the end, she was just like, God bless you. I'm so glad you called. I didn't know where to go. I didn't know what to do.
Ramirez says many people already have pre-existing conditions like high blood pressure or diabetes. Her call is sometimes their first chance to hear about healthcare changes in a language they can understand.
This is mi gente. I know that there's only 6 of us working, doing these calls, and we can't reach everybody.
But to Ramirez, it's their job to try. She says, especially when Spanish material from health officials falls short, communities are coming together to support each other.
They'll say, this is what I'm looking for. And we'll get 50, 60 messages, responses. I see milk here. I can give you a gallon of water. I can give you some milk. I can give you, you know what I'm saying? And it's beautiful. And people forget that.